Hello everyone. Right now we'll speak regarding the letter A. It's going in the middle of the M.A.R.C.H protocol. And actually three first letters, M-A-R, are the most critical and the need quickest completion of them. R is for respiration. When we should be aware of any troubles with respiration. When we will calculate some excessive breath movements. As a first example and most common. When you'll hear more than 21 breath movements during the minute, it means that maybe there is some problem there. Also, when you see some blood accumulations in the region of chest, you need also provide a rechecking of the patient's chest. How it will be performed, I will demonstrate right now. I have prepared our patient and evacuated his whole clothes. So right now I see his chest. What I need to do? I need to provide the examination of the anterior and posterior part of his chest. How it's performed? Usually with two hands. With one hand, I'm pressing on his skin, putting it towards the patient, and outwards with another hand. And I'm deeply investigating the zone between these triangle that is formed by clavicular and scapula and umbilicus. That's my region of interest. So I'm providing, investigating from both sides. Why I'm moving his skin in both variants? Because sometimes objectile shrapnel could be so small that you can not possibly differ it from any other amount of blood that had happened. So I have examined his anterior part of chest. After that, I examine his underarm and going this part of chest, and I will put him on his stomach, and I will explain his on the posterior part. For example, I have investigated his chest and I found a wound. What I will perform first, I will close with my hand. I'll firmly attach my hand to his chest, and I'll take a look to his IFAC. And I'm looking for another medical supply for his IFAC to use. What I need a chest seal. There are several types of chest seals that could be ventilated or non-ventilated, and there are different types of these ventilation systems. But you need to choose the vented one for the anterior part wounds, surely. So I'm opening the package and I'm taking a chest seal. What do you need to know regarding the chest seal? When you're ready to put it on patient, please be sure that you're pressing with your hand on his wound. After that, position the middle of the chest seal on patient's anterior part of the body, and with his breathing out, with his exhalation, remove that specific cover and apply it on a patient. After that, you need to provide all procedures to keep the wound in the middle of the chest seal. After that, these injury will be secured for some amount of time, and you can continue with another injuries. For example, of course, chest seal will not cure the patient from his chest wound, but at least it will stop or diminish the risk of development of the further complications, for example, pneumothorax. Of course, every chest seal that you have located on a patient should be rechecked. There are some possible signs, dangerous signs, and you need to recheck it. If you see that, you find out after applying the chest seal, you see that his breathing movements are increasing. It should be a notification for you to recheck the chest seal. If you see that patient has loss of consciousness or his consciousness is like lead to the finish, you should recheck the seal. How we are rechecking the seal? We're taking a look on it, and if you see here blood accumulation in the part of the ventilation window, we need to press it here, open it a little bit, then clear the blood accumulation, and then put it back. This operation can provide one, maximum 2 times. And of course, this patient should be immediately addressed to the next level medic.